Welcome to The Explainer. Today, we're diving into some truly remarkable medical procedures, the ones that step in when the digestive system runs into serious trouble. We're talking about everything from providing nutrition when someone can't eat to literally rerouting the entire GI tract. It's an amazing testament to medical ingenuity.
So, think about it. The gastrointestinal tract is basically the body's engine room. It fuels everything we do. So what happens when that engine room gets compromised by disease or an injury? When that fundamental ability to eat, digest, and absorb nutrients is just gone? Well, that's exactly where these incredible therapeutic procedures come into play.
First up, let's tackle a big one. How does the body get the fuel it desperately needs when the normal route, eating, is completely off the table? Turns out medicine has two really clever solutions for this exact problem.
This is what we call enteral feeding. Now, the key thing to get here is that the gut itself is still working. It can still digest and absorb nutrients just fine, but the person just can't get food there in the usual way. This could be because of trouble swallowing after a stroke, or maybe they're recovering from cancer treatments. It's all about using the GI tract, just with a different, safer entry point. But what if the gut can't be used at all? What if it needs to be completely bypassed? That's where total parenteral nutrition, or TPN, comes in. This is for situations like severe pancreatitis, where the GI tract has to rest, or something called short bowel syndrome, where there just isn't enough intestine left to absorb anything. With TPN, we sidestep the digestive system completely. And to really understand how powerful TPN is, just look at this. A standard IV drip, that gives you less than 700 calories a day, not nearly enough to live on. TPN, on the other hand, is this super concentrated, hypertonic solution jam-packed with dextrose, proteins, fats. It is truly complete nutrition delivered right into the bloodstream. This chart just lays out the difference perfectly. Think of it like this. Enteral feeding is Route A. It uses the existing highway of the gut. TPN is a direct bypass. It's for when that highway is closed for major repairs, and you have to deliver the fuel straight to its destination, the bloodstream. Okay, this is so important. Safety is absolutely crucial with TPN. Because it's so packed with sugar, the body needs time to get used to it. If you stop it suddenly, you can cause a really dangerous drop in blood sugar, something called hypoglycemia. That's why the flow rate is always tapered up slowly and then tapered back down very, very gradually.
All right, let's shift gears. Now we're going to look at procedures that act like release valves for the body. They're designed to relieve dangerous pressure that can build up inside, whether it's from fluid or from some kind of blockage.
So this is a paracentesis. It's for a condition called ascites, where a ton of fluid builds up in the abdomen, usually because of something like liver cirrhosis. And this isn't just a little bloating. The buildup can get so severe that it actually pushes up on the diaphragm and makes it hard to breathe. This procedure gives immediate, sometimes life-saving relief.
And as you can see, it's a very controlled process. The patient sits up so gravity can help pool the fluid in one place, and then it's drained, slowly. And there's a good reason for that. Draining it too fast can cause a massive, dangerous drop in blood pressure. After they've removed several liters of fluid, the patient's vitals are watched like a hawk.
Now, what if the pressure isn't from fluid, but from a blockage in the intestine? Well, for that, there's nasogastric decompression. A tube is passed through the nose, down into the stomach, and then hooked up to suction. Think of it like a little vacuum that removes all the trapped gas and fluid. It relieves that painful bloating and gives the bowel a chance to rest and hopefully fix the obstruction on its own.
Okay, and finally, let's explore one of the most significant interventions of all. What happens when a part of the digestive system is so damaged or diseased that it has to be either rested for a long, long time or removed entirely?
This is called an ostomy. The surgery creates an opening on the abdomen, and we call that opening a stoma. You can think of it as a rerouting of the digestive highway. When the normal exit is blocked or gone, maybe because of cancer or Crohn's disease, an ostomy creates a new, perfectly functional one.
And the health of this new opening is absolutely paramount. You got to remember, the stoma is living tissue. It's part of the intestine. So a healthy stoma that's getting plenty of blood flow looks pink and moist. But if it turns pale or bluish or, God forbid, black, that is a massive red flag. It means it's not getting enough blood, and that is a true medical emergency.
Now, not all ostomies are the same. The main difference really comes down to location. An ileostomy is an opening from the small intestine, the ileum. A colostomy is from the large intestine, the colon, and this location changes everything about the output because the large intestine's main job is to absorb water.
This table makes it crystal clear. With an ileostomy, you're bypassing the entire large intestine, so the output is going to be liquidy and pretty continuous. But as you move that stoma further down the colon, from the transverse section to the sigmoid at the end, more and more water gets absorbed. The stool becomes more formed, sometimes even close to a normal bowel movement.
You know, a huge part of living with an ostomy is learning how your diet affects everything. Certain foods like eggs or fish might cause more odor, while things like yogurt or parsley can help control it. Same thing goes for gas. Patients become real experts on their own bodies, managing what they eat so they can live comfortably and with confidence.
So, after looking at feeding tubes, pressure relief, and completely rerouting the system, what's the big takeaway from all this?
At the end of the day, these interventions are so much more than just medical tasks. They really represent the body's second chance. Whether it's finding a new way to provide nutrition, relieving life-threatening pressure, or creating an entirely new path for digestion, they're just this profound showcase of biology and human ingenuity working together. And that leaves us with a final thought, right? We've seen how medicine can help the body adapt and heal today. But as technology and our understanding of physiology keep rocketing forward, what new, even more incredible possibilities are waiting just around the corner to help the human body heal, adapt, and thrive, even against all odds?